Sparking Our Leadership During the COVID-19 Pandemic, a Schweitzer Fellowship Approach. This is a platform for Fellows for Life and fellows to come together, learn from and interact with experts, and have a space to collaborate with each other as we exchange ideas, encouragement, and accountability in our breakout sessions. Our first meeting featured an inspirational talk by Dr. Lachlan Farrow, calling for our community to come together, ignite the spark of the human spirit, and address community needs at a rate greater than the spread of the virus. Following Dr. Farrow's talk, participants collaborated in breakout rooms, painting a picture of how COVID-19 is affecting us around the nation while inspiring hope, collaboration, and accountability to be the change. We learned how COVID-19 is creating foreseeable urgent needs as it moves through the population at an exponential rate. We also learned some inspiring ways current fellows are taking the lead in addressing these issues now. For example, Julia Walzak, current Chicago fellow, is working on a national student COVID-19 response registry, creating a national database so local hospitals can leverage allied professional students living in their area when the need arises. And Ashley Peoples, current Detroit fellow, published an op-ed in Scientific America describing how medical students can give vital help during the COVID-19 pandemic. These are just a few of the many courageous initiatives being implemented by the Schweitzer Fellowship community. I look forward to continuing where we left off, but first, a couple of housekeeping items for Zoom. You have a microphone icon at the bottom of your screen. Please make sure this is muted until you are in the breakout rooms. You also have a chat icon at the bottom of your screen. If a question comes to mind for our guest speaker, please click on the messenger icon, type in your question, and send it to Ekena Ezenwa, our moderator. Ekena will ask the question, time permitting, during the Q&A session. Our moderator tonight is Ekena Ezenwa, Fellow for Life 2018, Tulsa, Oklahoma. Ekena is a fourth-year medical student at the University of Oklahoma School of Community Medicine. For her fellowship project, she partnered with Carrera Adolescent Teen Pregnancy Prevention Program at Union Public Schools, providing health education, mentorship, and exposure to medical professionals to high school students. She has been accepted into a dermatology residency in the Chicago area. Ekena?
Hi, good evening, everyone. Welcome to the second part of our three-part series. We're so excited to have you. So this layout will be similar to last week. For those of you who are joining us for the first time, the layout is as follows. We first start with a discussion and a Q&A session with our speaker, Dr. Linda Murray. Then we divide it into our breakout sessions. If you've never done this before, it will be completely randomized by the Zoom software. Lastly, we'll come back and hopefully have one or two of you share what you've talked about. Then we will go over general housekeeping and plans for the next session. So first, I would love to introduce Dr. Murray. She is a champion of social justice and an outspoken advocate for the medically underserved for more than 40 years. She served on the board of the Schweitzer Fellowship for 6 years and is the past president of the American Public Health Association. Dr. Murray was the chief medical officer for the Cook. So Dr. Murray, I will let you take over.
Well, good evening, everyone. Welcome to the webinar. And hopefully everyone is staying safe and staying busy. You know, it's not clear to me how much we appreciate what's really going on today, because it gives us an opportunity that doesn't happen often in human history to really see, I think, very clearly the problems we face in this country and the world. What I've been telling some of my students is the most contact, for example, my granddaughters have with this pandemic is from the Twilight series. Some of you remember that series when you were young, right? And it's the vampire. I didn't like him. I liked the werewolf better. But the vampire guy, what was his name? Whatever his name was, he died or became a vampire in the 1918 Great Flu pandemic. That's his backstory. So I want to say that what is going on now? We spend a lot of time on the evening news and the media, and I think this is important to keep people's spirits up, with people organizing in their community, organizing in their workplace, trying to really put their shoulder to the wheel to address this horrible situation we find ourselves in. But I would ask you to back up from that a little bit and really think in a more professional way about what this really means. Many of you I know are not surprised that we have a pandemic, and let me start there. So we have to really evaluate how we're addressing this. This is not a surprise. This is the third or fourth pandemic in my lifetime. It just happens to be the worst nightmare, the perfect storm. HIV in many ways was a pandemic, MERS, SARS, H1N1. So we've seen these repeatedly. And in this instance, we have the perfect storm of a transmittable, easily transmittable novel virus spreading around the world with lightning speed. And it makes clear, for example, that what a country like India can do to address the pandemic is very different than what European countries can do. What happens in the North Shore of Chicago, where people have nice condos and 2 or 3 bathrooms and lots of bedrooms, is very different than what happens on the west side and south side of Chicago. So we're beginning to see data, not from everywhere, but from the places that are choosing to report it, that African Americans are disproportionately impacted by this. I expect Native Americans to be disproportionately impacted, especially ones living on the reservation. I expect to see those populations in our society who are oppressed that get the worst end of this stick. And so whatever we're doing in terms of collecting materials, helping seniors in your community, those of you that are working in healthcare, whatever we do in that capacity, we would be remiss if we didn't stop and consider how the real cracks and deficits in society are being revealed by this moment. We estimate that 7 million Americans who had health insurance 3 weeks ago no longer have it because they've been laid off from their jobs, and the ones that had health insurance, and they've lost it. So I don't care where you turn, whether it's our lack of preparedness as a nation, whether it's the fact that we don't have enough public health personnel to address the next step of the pandemic, whether it's the reality that when we choose to close down a school system in Chicago, for example, there was a real debate several weeks ago, should we close the school system down or not? Why? Because we have 20,000 homeless students in Chicago. What happens to homeless students when you close down their major shelter and source of food? So what happens in this kind of situation where the entire society is challenged is that it reveals our weaknesses. Now, what it also reveals, which I think is what we're trying to focus on tonight, is it can reveal our strengths. It can reveal what we have in common. It can shed a light on what we need to do. But I think it's important that we have a real approach to these activities that raises and answers the question, what happens in 2 years? Because this is not going to be over next month. It's not going to be over in 6 months. What happens 2 years from now? So you might feel real good right now to make sure that I know medical students in our area are collecting PPEs to give to healthcare workers, but what happens in 2 years? Why is it that we are allowing some costs for eggs, milk, other material goods to go up? Why do we allow that? Why do we have $1 trillion bailout program that gives trillions to the airline industry, hotels, and other big business, and relatively a small amount to small businesses, and an even smaller amount to individuals? So what my concern is, my challenge as I think about what I do on a day-to-day basis, is how can we take this episode of this pandemic and explain it to people in a way that they understand how it developed and they understand what we have to do collectively to try to control it. Right now, as the media focuses on the shots in New York or the shots in Italy or wherever the latest breakout is, and we look at ventilators and people on stretchers, that's really not what's going on. What's really going on is what you can't see, what they don't spend time on. And even if the curve has been, though I must say, I am delighted as a public health person that everybody's talking about bending the curve. I never thought I would see the day where that epidemiological concept would be so widely spoken of. But if in fact we survive and are successful in not totally overwhelming our medical care system, then we are left with a real problem because we don't have a public health infrastructure in this country. So if you ask yourself what happens in the next few months, assuming that the curve is bent, and that's an optimistic assumption, but let's assume for a moment that that does happen across the nation, then what's required is really a huge public health workforce to actively and aggressively do contact tracing on people that begin to, in smaller numbers, but begin to be positive, and so that you can try to contain and control the epidemic. If we don't do that, then this will just go up again. And so what I've been telling my colleagues, I'm old and high risk, so I've been staying in the house, but what I'm telling my younger colleagues who are able to do a little work and go outside is, when you organize your volunteer programs, when you try to address a problem, don't just think about addressing that problem today. Because if you address that problem today, you're really addressing a problem that goes back several weeks and frankly back centuries. What you really need to ask yourself is, what can I do today that makes it easier to solve the root causes of these problems? What can I do today in terms of how I organize people and what people learn from this episode that makes it possible for us to have universal health care in this country? What can I do today to say that it's no longer acceptable to have people work for tip wages, which is $2 or $3 an hour? Our very notion of what's essential. Again, it's important, and certainly as a physician myself, I admire my colleagues as they care for the sick, but just as essential are the people that make sure we can still do this Zoom conference, that make sure the electricity's on, that make sure that when you turn your tap, the water runs out, that make sure that you can get food delivered, or if you go to the grocery store, there's actually some food there on the shelf. These people and these workers are just as essential, and in fact, I would argue more essential in the long run than the people in the ICUs. So if we have that in our mind, then we begin to have a different kind of calculus for what we need to do. So while we may organize PPEs, while we may bring people out of retirement, I'll be doing some telemedicine. I retired a number of years ago, but I'll be doing that to release people to work in the hospital setting. That as important and as feel good as those activities are, they aren't good enough if we're not organizing for 6 months, 12 months, 2 years, 20 years down the road. I think that in Chicago, at least here in the Midwest, we've seen, not surprisingly, the disproportionate impact that I mentioned earlier. When this begins to hit our rural communities, we'll see another major problem. There are 3,000 counties in the United States, more or less, and 15,000, half of those counties, do not have one single ICU bed in the county. Our rural communities tend to be older. They tend to be poorer. And as this pandemic rolls through the rural counties, we will see a devastation that we haven't even seen in the city. And I'm afraid that it will not get the same kind of attention that it gets in the city. So again, in my mind, the organizing question that we face as activists is, how can we bring together people that don't usually sit in the same room? How can we bring together people that may work on a homeless project with people that may work on a housing or may work in a hospital setting or may work in education? Because it's only by bridging these silos that we have any chance of organizing our way to have an appropriate response. All of our problems are interconnected, and so you can't close a school system if you don't understand how to get those kids food. And you can't give people instructions on what to do when they feel sick if you don't understand that more and more people won't have any kind of health insurance. And you can't address the problems we see in our prisons and jails and our detention centers, the ICE detention centers, if you don't understand that they are a source of infection for the rest of the population. What's going on? We've already lost one of a young man in the jail in Chicago at Cook County Jail, and we will see more people die. In this country, to remind you all, the only people in this country who have a legal right to medical care are people that are incarcerated. You and I don't have a legal right to medical care, but prisoners by case law in the United States have a legal right because we incarcerate them. They can't get out and get medical care on their own. But we haven't released them. We should have released thousands of people from jail already. Iran released 70,000 prisoners. That's the first thing we should have done. We haven't done it. I know locally we've released 400 or 500 prisoners in our Cook County Jail. At the state level, I think they've released a similar amount, but we should be releasing thousands of people from our prisons, and the ICE detention centers should just be shut down because no one there is even accused of a real crime. So what I'm concerned about is, will your work that you're going to do tomorrow morning, how do you connect that work up to the fundamental root causes of this problem, which is not a virus? And how do you connect your work up to other people's work to make changes in this society that we really want to see? That we can build a different kind of community where when pandemics happen, there's no question about solidarity. I think that what I've been doing since I've been homebound is spending a lot of time on media issues and talking to radio and TV stations about what's going on, especially Black radio stations. And as you do your questions, I would be interested in hearing what you all are doing. Let me end here just a little bit early so we have a few extra, 2 or 3 extra minutes for questions.
Thank you, Dr. Murray. I think that's a really great perspective and something to consider, really making sure that everything that we're doing focuses and addresses all the problems the things that have stemmed and had these cracks in our society. So we do have a couple of questions. So I'll start off with the question, which is, how do we begin to organize an effort to help address the root causes of some of these disparities that the pandemic has revealed? Like, how do we start?
Well, I think the first place we start is by ourselves coming to a collective notion of what those root causes are. I would not assume that everybody agrees on that, but I think when you are faced with a specific problem that you're working on, for example, 50% of our kids in the CPS in Chicago Public Schools get their major nutrition from the free lunches, breakfast, lunch, and snack at school. In the summertime, of course, we still arrange to get school. So we should raise, while we organize that, you may be working on packing those lunches. You may be working in a setting where you're arranging for safe distribution of those lunches. We can ask the question to the parents, why is it that we have children that are fed through the school system? Why isn't a basic nutritional floor everybody's human right? You start there. You start by asking the question. Pretend you were 2 years old and you were talking to your parents. Why is it this way? Start there. And the other thing I would say is that in this right now, we are spending trillions of dollars because this is a worldwide emergency. Think about 6 months ago, if you raised a question like improving SNAP, the query would be, we don't have enough money. We have money to spend on what we want to spend it on. Okay, so we do have enough money. It's a question, do we have the political power to do it? But first, figure out what the root causes are. Read some history and talk to your colleagues and ask yourself, why do things work this way?
Excellent. Our next question is, what are the chances or the current models saying about a second wave happening? I feel people are working hard right now with a very limited timeline in mind.
I think people are working with a very limited timeline. So we have modelers all over the country. You may have seen in the news, there are different models, and they're fine. They're all based on certain assumptions. In my personal opinion, I'm not a modeler, but after looking at all the models, we don't have a vaccine for this. We don't have definitive treatment. And we're not going to have a vaccine anytime soon. 18 months to 2 years is a very aggressive timeline to have an effective vaccine. So if everything worked perfectly, but remember, this is the United States of America, so it's not going to happen. But if everything worked perfectly, we would have to do very aggressive contact tracing to keep the number of infections at a state where our medical community could handle it. If we back off of our isolation, of our closing the schools, of all of these things, then we will see it rebound. That happened in 1918. It will happen here. Right now, as a nation, we're not all on the same mitigation program. And so we have states where no mitigation is going on, and that's going to keep the infection going around. So I'm not convinced that we will see a true bending of the curve across the United States like we may be seeing in Italy and some other places. So I think that we will be cyclical. I think that we will have periods where things seem to be quiet in certain regions, and then they'll go back up again because we have so much traveling. So I expect a cyclical pattern with this pandemic, with the resulting morbidity and mortality. Unfortunately, over the next year or two, we may see that different in other countries if they're able to have a better control. But in this country, where we seem to have difficulty doing that, I think it's unlikely that we'll be successful.
Our next question is, so a huge part of being a Schweitzer Fellow is being creative in our approaches to improving our communities. What do you think we can do right now, given our current physical limitations, to contribute creatively to the fight against COVID-19?
Well, you all will think of creative things to do. Let me just say this. I'm less impressed. When people say we're being creative, we're dealing with problems, what that says to me is we lack the power and the resources, okay? So yeah, in my family, we were creative with dinner. We had a lot of stews and beans and rice because we couldn't afford other things. So yes, you do what you have to do, you be creative, but what I would like you to do is worry less about being creative and say, how can we get control of the resources we need to do what has to be done? That's a very different kind of question. So this is not and I don't know you all personally, but let me say this as a general comment. I don't mean to insult anyone. This is not about a missionary approach to what's going on now. Missionary approaches to problems of the world hasn't gotten us very far. They're nice, but they haven't gotten us very far. So we need to begin to insist, for example, on a minimum wage. Our grocery store workers are getting a bump in their salary. We should say the minimum wage shouldn't be $15 an hour, it should be more than that. And these grocery store workers are essential. We need to fight right now. We don't have to wait for their base salary to be higher. We need to fight right now for universal health care. Let's have Medicare for all passed immediately. There's no reason why we couldn't do that. We do have to have some changes in the White House, but ignoring that for a moment. So I think my challenge to you in terms of being creative is don't stop at half solutions. You can work on immediate problems. If you have a sick patient in front of you, you have to take care of them. You have a hungry child in front of you, you have to find a way to get them food, but insist on doing what needs to be done. Think and talk with each other and say, what really do we need to do in my community to solve this problem? What can we do? And you'll find that it often requires, uniting across different communities and across the whole country. So to quote Brother Wang, there was a candidate, yeah, why not a universal minimum income? I wouldn't have it as low as he did at 12,000, but why not? So that everybody in the country should be able to have food, clothing, and shelter, and healthcare.
Perfect. That makes sense. Thank you. So our next question is, you said kind of in the beginning of the talk that you've experienced 2 different pandemics or crises in the past, and the person wanted to know what kind of resources or things did you guys do to have these collective changes where you're solving these cracks? So kind of some stories. Well,
I wish I could say we had solved the problems. We haven't, but I was pointing out that because we don't think of them that way. HIV was really a worldwide pandemic. It fits the definition. And some of you are too young to remember, but you can read it, and a number of you on this call are old enough to remember how people responded to the HIV epidemic in the early days. and what we learned. So we began to accept lay people challenging the scientific community and scientific dogma. We began to put together resources in a different way for patients that were afflicted with HIV, to put together housing and food and all these needs together and not treated as separate clinical issues. So we can, I think from HIV, we can see an approach that is closer to what we need to do here. The other pandemics were much shorter and didn't impact the United States as much. I mentioned them just to remind you that they exist. The two more recent ones were coronaviruses. MERS and SARS are both in the same family. And we're just lucky that the nature of those viruses were such that they didn't impact the United States that much. So the point I'm trying to make is where we've seen changes, whether it's the institution of Social Security or whether it's voting rights for the South, it requires a movement and it brings together people from all walks of life. And when we do that and demand what we really need, then we make progress. If we don't demand what we need, then we don't make progress, we go backwards.
Our final question, I'm going to share it with everyone because it is and I'll read it out loud as well. So currently the Trump administration is trying to weaken the scientific underpinnings of policymaking with the proposed policy change called the transparency rule or secret science rule. If they succeed and the rule changes, studies that have been used for decades to lead public health standards, practices, and policies might be inadmissible when existing regulations come up for renewal. This will undoubtedly have a major impact on the Black community and low-income communities. How do we continue to educate on issues that will have a longer lasting effect with imminent danger is at the forefront of everyone's mind?
So I'm so glad you asked that question because I think especially those of us with some training in healthcare, I think we get too glib about this. So I don't think we do a very good job. Yes, Trump is an idiot and he doesn't believe in science, but unfortunately he's not alone. I wish I could say science was cut and dry. It's not cut and dry. Science is an area of argument. Otherwise it wouldn't be science, it would be accepted fact. Or if it's not fact, it would be religion. So in science, the only way we make progress is by arguing about what we're seeing and what we think is going on. And we have to, if we're going to be good scientists, be able to live with a certain level of uncertainty. And so in policy making, I personally do not like this notion that we're evidence-based. I think that's a lot of nonsense. If we were evidence-based on everything, half the world would be dead. I don't mind being evidence-informed. So around COVID-19, when Dr. Fauci stands up there, he's evidence-informed. He doesn't know, we don't know a lot about this virus. So what we want to do is to be evidence-informed, and we want to be able to ask the questions and engage in debate, scientific debate, and we want to be able to live with the concept of uncertainty because we don't know exactly what's going to happen. And so if you notice in the media, the press gets very upset if one model said, 2 million were going to die, and then another model says 1 million is going to die, and then they say, oh, well, science is useless. That's because we don't really understand the role of science and the purpose of science. So you're right, we do have to fight that particular legislation, but that's not the only place where we're in trouble with people not accepting science. It's not a question of accepting science. Do they understand science? Can they engage in a discussion based on information and based on some basic approach to how we use information?
Mm-hmm. So I think that is all the time we have for our Q&A session. Dr. Thank you so much. I feel like that was very inspirational and also very educational. One thing that you said that really resonated with me is how do we bring people and activists together, especially when we're all kind of looking at the same problem from different perspectives and realizing that a lot of our problems all come from these very similar root causes. And one thing that I kind of want to make sure everyone's aware of is that we, as a Schweitzer, for this webinar series, we did create a Google Excel that we're asking everyone to kind of voluntarily put their contact information and what they're looking at or what problem really has resonated with them, so that you can connect with others who might have similar experiences or different perspectives for you to really grow and guide from. So kind of just a little plug for that as well. So now we're going to break up into our Zoom sessions, our breakout sessions for groups for about 3 to 5 people for 20 minutes, building on the breakout sessions from session 1. And those questions should be in your instruction guide or on the email.
That's great. And you all have a great discussion. I'm going to put my email up here. Somebody asked how to reach me, so I'll put my email in the chat.
All righty, are we all back? Okay, so we're gonna go ahead and kind of kickstart what you guys talked about in your discussion. So if anyone is willing to volunteer first, giving us a little recap, or I will start calling on people. Okay, I'm gonna start calling on people. Oh, okay. So I'm gonna ask Tony from Tulsa if she would love to give us a recap on their discussion.
Hi, everyone. Yes, I'd love to. So I was in a group with Kristen and Amelia from LA and DC respectively, and they kind of both work in a health field, and so I kind of learned a lot from them and the issues that they're facing. Amelia works in DC with people who have rare diseases, and so she kind of spoke about how they're kind of facing people that have to go to the hospital but don't know if they can because the hospitals are full of COVID patients, and they kind of have to run the risk of getting care, but at what cost to their health. And then Kristen had talked about working in occupational therapy and how she's trying to figure out ways to alleviate burdens of the industry as a whole, and she's been working to help COVID patients that are already recovered, just to increase their endurance and strength. So they're both kind of facing problems with like figuring out how to help their patients from afar, but being there for them as well. So they talked about remote and telemedicine.
That's awesome. And I feel like that's awesome to think about. You know, these patients are obviously suffering at the time of their illness, but then also what happens afterwards. So it's really kind of thinking ahead into the future as well. One thing that I'll share with my group, so it was Ashley, Andrea, and Sarah and I, and Andrea was discussing how she works as a nutritionist for WIC, and is currently kind of getting a document to find like food access for her population, or different places so that kids are able to have food, especially ones that were kind of relying on the school system. And Sarah mentioned that she actually has a resource and works at UChicago and is going to provide that for them. So I think that was really cool to see, just because, you know, we have these meetings so that people can connect and maybe find resources that are already available or can be like enhanced with the work that they're already doing. So I wonder if there's anyone from maybe Boston that would like to contribute, or if maybe someone from the Northeast who would like to contribute what their group discussed.
Sure. Jameson Davis here. I am a
Oh, James, you're muted. There you go.
Oh, sorry. Can you hear me now?
Perfect. Yes.
All right. Jameson Davis here. I am a future fellow coming in for the year 20 to 2021 in New Hampshire, Vermont chapter. So shout out to them. I had the pleasure of being in a group with Product Doshi, Jasmine, and Barbara. We've had a pretty wide range of conversations and great topics. We discussed, they were in the medical field, so we discussed some of the similar issues there that was discussed earlier. We also talked about some of the the bureaucratic and other unnecessary obstacles that are currently, in our way that hopefully won't exist after COVID. We also had a discussion in terms of on the legal side of things, what does it look like in terms of the federal government stepping in versus it being a state issue and how to respond, and what type of things could be done with state power and preemption and things of that nature. So yeah, we had a pretty good detailed conversation.
Yeah, that's a great discussion. It's very in-depth, and I feel like this is a great group to discuss that with.
It
Yeah.
was definitely enjoyable for sure.
Yeah. Well, excellent. Thank you guys for all your contributions and for sharing with the large group. I think we have some comments on trying to make sure that you guys have more of a warning before we go from breakout session to large groups so that you guys are able to kind of finish your discussion. So we'll try to see from a tech side if we can make that happen for the webinar 3. I think getting to talk with you guys is an amazing part, just to see that all the great work that you guys are doing. So thank you for joining us. So next Tuesday, we have our final part of the series with Dr. Erica Pan. She is a Schweitzer Fellow for Life and the director of the Division of Communicable Disease Control and Prevention, and the Deputy Health Officer at the Alameda County Public Health Department. She's also an attending physician for pediatric infectious diseases at the Children's Hospital and Research Center in Oakland, and the clinical professor of pediatric infectious disease at UCSF. So I'm going to hand it over to Paul for our closing.
All right, awesome. Thank you guys so much for attending tonight's webinar. I'm just gonna recap again. During our breakout sessions, we learned a lot about what it looks like to be a part of the solution to COVID-19. Now is the time to take action towards implementing that solution. If you need help or hit a roadblock, please reach out to someone in our network by using the Albert Schweitzer Fellowship Directory, located on the Google Excel sheet that was sent out in the latest email. And remember, the A3 is a great tool for organizing your map to success and implementing your solution. The A3 was also sent out in the last email. Finally, if you noticed a Fellow for Life or fellow that did not attend tonight's meeting that you think would enjoy our webinars, please forward the next marketing email to them. Looking forward to next Tuesday, everybody. I'll see you there.